There is an unacceptable acceptance of having recurrent seizures and not opting for something like epilepsy surgery.
Thank you very much for joining us today, Ajay Asranna. Could you please tell us all a bit about yourself?
I am Dr. Ajay Asranna. I am a neurologist and epileptologist. I'm based in Bangalore, which is in the southern state of India. And I work as an assistant professor of neurology at the National Institute of Mental Health and Neurosciences, which is at Bangalore, India.
Can you tell us what has brought your focus to the epilepsies? What brings your passion to that?
I've always had a fascination for the brain and to try and understand how the brain works, and that is what attracted me to neurology in the first place. And then when I was training in neurology, I learned more about brain networks and things. And I realized that epilepsy is a good, it gives us a good vantage point to look at the various brain networks. And it is one area where you can, understand the brain from up close, so to speak. As you know, that we have various ways of trying and interpreting the signals from the brain. It can be through EEG, which can be placed on the surface of the brain, or even intracranial EEG, where you record from the depths of the brain. And so that is something that was very fascinating to me. And I was fortunate enough to be trained in a center which was doing very good work in epilepsy surgery, which was in Trivandrum in the state of Kerala.
You personally sent a couple of papers to me about epilepsy and epilepsy surgery in India. And I wanted to ask you about the challenges for people with epilepsy in India, people who require epilepsy surgery, and what can hold them back.
India has a very, large population. So we have about 1.4 billion people in India. And then the prevalence of epilepsy is also quite high. So by some estimates, we think that maybe nearly every year we have about 5 lakh people developing epilepsy in India. And about maybe 1/3 of them will develop some sort of drug refractory epilepsy. So we could say that maybe 1.3 to 1.5 million people in India could benefit from epilepsy surgery. So that's the challenge. And we have about 1,000, it's a rough estimate, about 1,000 epilepsy surgeries being done throughout the country in India. And every year it is getting better. We have more centers doing epilepsy surgery now. But despite that, this is what we call as the surgical gap. So that's quite high in India because of the sheer number of people who need care.
Is it solely the huge number of people who require surgery, or are there other contributors to the lack of surgery being performed?
We have a number of problems, like we can say that there is a knowledge gap and then there is a feasibility gap. The knowledge gap is regarding the awareness. So awareness of epilepsy itself is not, it's not even throughout India. If you see, we have a very diverse kind of population. We have diverse settings, diversity in region, culture, and then in socioeconomic status. And then the beliefs in epilepsy is different. There's a lot of stigma attached to epilepsy. And then our understanding of epilepsy is different in many parts of the country. And how they approach the treatment is also different in that sense. The first step is a big problem. So the awareness of the disease itself is the problem in some cases. That is step one. So there are also people who have good understanding of epilepsy as well. But then they may not know that epilepsy is something that can be treated with surgery. And that awareness has not yet percolated. That can be with the patient or the family of the patient per se, or it could even be with the doctor who is treating the patient. So that awareness has to really go out there and it has to percolate for people to understand that.
Not enough people being referred for surgery may be down to what you've just mentioned, so families, culture, etc. And how much might be down to lack of understanding and knowledge of clinicians?
It's very difficult to put it up in numbers, but especially in India, in most parts of the country, I think at least 80% may be because of a lack of understanding on the part of the patient and the family. And then maybe there are about 25%. These are absolutely, I have no hard evidence to base this on, and this is just a speculation. But I think that might be something like that, because what happens is sometimes they reach even a tertiary care center like where I practice, and then we offer them epilepsy surgery, and then we still see that reluctance. So I believe that there is, on the part of the patient, I think the knowledge gap is higher.
We certainly have a lot of people here in the UK who, and other countries that I work with, Australia, States, Canada, a lot of families who feel very similar and are very nervous about the idea of surgery, let alone actually them having surgery or their loved one having surgery, because people just don't. This is another generalization, but lots of us have no idea about, the risks versus the potential benefits, and it's all like risk, rather than. And I've said this in other podcasts before. My neurologist said to me and told me that my life expectancy wasn't great without it, and which I loved, like that he actually told me that, and that helped me make the decision. I don't think many clinicians can actually say that to a patient, and many patients can take it, but I think that's maybe a message that needs to be conveyed in some way, that life expectancy is seriously affected, whether it be down to the potential for accidents, whether it be SUDEP, sudden unexpected death in epilepsy for people who aren't aware, and also quality of life.
Absolutely. So there is so much more to epilepsy surgery than controlling of seizures. So it is very important to control seizures, as you rightly said. I think so that is a term that was used in one of the papers. Where there is an unacceptable acceptance of epilepsy, of having recurrent seizures, and not opting for something like epilepsy surgery. And so that reasons may be multifold, and that is something that we need to be, going out there and trying to convince people that epilepsy or recurrent seizures is not something that has to be taken lightly. It comes with increased risks of SUDEP, increased risk of accidents, which can happen anywhere from drowning to accidents on the road. It could be dangerous for you or somebody who's whoever another person who's on the road, especially if you're driving and things. So I think this is something that has to be taken into consideration. And of course, the quality of life part is well established by many studies. And in fact, I also had a paper on the effect of epilepsy surgery on sleep. Even something like sleep is also affected by epilepsy, and definitely you sleep better, and then a lot of things improve. It has good effects on overall. If you look at the memory, or it could even be how you can join back in terms of occupation, or even how productive you can be in life. So all these things are also related to seizure freedom, and that is not something that we should be taking lightly.
Again, going back to myself, but it's very clear that lots of people will not achieve seizure freedom as a result of epilepsy. There is always, the case that might happen, and lots of patients. All patients should be told about that, or carers should be told about that prior. And yeah, I can see you agree with that. But you have to weigh up the pros and cons. So, for instance, in my case, I have far fewer seizures, and my quality of life has improved significantly as a result of surgery, and I consider it a complete and utter success despite that fact, because my expectations were managed.
So we need to be realistic when we say what are the outcomes we are looking at. So the best outcomes we have is in terms of temporal lobe epilepsy, where we have about 70 to 80% success rate of getting complete seizure freedom. So while we may not be able to attain complete seizure freedom in all cases, even a substantial reduction matters. And then what also matters is how early you do the surgery. So there are many factors which affect the outcome of epilepsy surgery. And one of the most important factors is the duration of epilepsy before you underwent surgery. So there has been some evidence to point to the fact that if the epilepsy surgery is done within 5 years of a patient becoming drug refractory, which is the failure of two anti-epileptic medications, which are well chosen and the correct dosage, and then they are not able to control the seizures, in which case you undergo a pre-surgical evaluation, and find out that, okay, you are a good candidate for epilepsy surgery. And if you undergo surgery within 5 years, there is a good chance of seizure freedom, as opposed to getting it done later at a later point in time, maybe 10 years or 15 years down the line. And there are multiple things which may be irreversible, like the effect on the psychiatric comorbidities or other comorbidities, which may be irreversible at a later point in time. So all these factors matter, and these should be factored in when you are trying and explaining somebody of what sort of what outcome to expect.
I wish that I'd had the opportunity to have surgery at an earlier stage, because I'm completely with you, AJ, what you just said. There are so many other negative things in life that potentially could have been avoided. And, especially what you were saying, the psychiatric issues that many people have, perhaps things wouldn't, in my case, gotten so severe. And I'm sure that's the case for so many patients. So, well, it's been absolutely lovely talking to you. Thank you so much for your time. And with this just little glimpse into the similarities but differences between what it's like for people with epilepsy to have epilepsy surgery or not, and access to that surgery. And yeah, if anybody has any questions, we have AJ's links down below under this recording, and please get in touch or message AJ, and I'm sure if you've got any questions, he'll be able to answer those.
Thank you so much. It's been a pleasure talking to you, and you're an inspiration to all people out there with epilepsy. And I hope more and more people realize the importance of adequate treatment and being more aware about epilepsy and epilepsy surgery.